Hi, I'm Dr. Christina.
And I'm Dr. Jen.
And today we're going to do a little bit of word association from a pediatric emergency doctor
And a pediatric primary care doctor.
All right, are you ready? Here's how it's going to go. We're going to flash up a word and we're each going to say the first thing that comes into our head and maybe share a health tip or two. All right, ready? First word is abdominal pain. Go.
Constipation, probably the most common thing I see when it comes to abdominal pain in kids.
Appendicitis, needs to go to the operating room. So my health tip for this one would be if you have a child who has had consistent, sharp, lower abdominal pain for over 4 to 6 hours consistently, get them checked out. The last thing that you want to see is a ruptured appendicitis or something serious like that.
And if your child is otherwise feeling well, but all of a sudden there's some just hurts, it's important to think about increasing fiber, increasing fluids, and really getting rid of those white starchy foods, you know, potatoes,
Good
things
one.
like that. So
Okay, number one. Okay, number two. Ready?
number 2 is headache.
Headache, meningitis, definitely.
And for me, I'd say the most common thing is tension or stress headaches in kids that parents often don't really know about.
Yeah, it's a scary one. Headache in a child is very scary, and if it's associated with vomiting, neck pain, or sensitivity to light, I think that's something that's always concerning and needs to be checked out quickly to make sure that it isn't something serious like meningitis.
Right. And also, if they are just having a headache, maybe it was a long day or they were on the computer all day, having a break, lay down, again, drinking lots of fluids can be helpful, as well as a cold ice pack on the head as well too, and a dark, quiet room. Sometimes that really does the trick.
I like it. All right, last one up in this series, cough.
Cough, probably the most common thing, upper respiratory infection or the common cold.
I'm giving it croup, right? I see a lot of bark, seal-like coughs in my practice, and that can lead to respiratory distress and croup. Also, loud, noisy breathing, that is another sign of croup. And one thing that I would recommend if your child has that kind of bark-like or seal-like cough, then go downstairs, open up the freezer, and breathe in that cold air, or open up the window.
That's a great trick.
Yeah, right? Breathe in the humid air. That can help settle things down. If that doesn't work, need to get seen right away.
Right. And for the common cold and those types of coughs, steam works really well.
You bet.
Lots of fluids, saline, and a little TLC goes a long way, and your child will feel a lot better.
I like it. Word association, part 1. High five, lady. Great.